Hello everyone, this is Mary Gregory with HIM Coding Academy. Welcome to our educational video today. Today we're going to be talking about neoplasm coding. As usual though, I got to tell you, I'm in this beautiful Charlotte, North Carolina, and this is our September educational session, and it's being brought to you by Medical Coding Lounge. Now, before I get started, I want you to do me a big favor. I want you to subscribe to this channel. I want you to like this channel. I just want you all to help us to get these videos out to more people. And I really appreciate that. And also look to becoming a member of the Medical Coding Lounge. We do education there. It's a very, very cheap monthly fee. And you get CEUs too. We do education twice a month, and you can get CEUs for that as well. Okay, let's talk about neoplasm coding. Today I'm just going to do, this is going to be part one, and we're just going to talk a little bit about the fundamentals. And one of the things that I feel is crucial that you know and understand is the morphology of neoplasm. Now, morphology simply means these are the characteristics of this neoplasm. Every neoplasm simply means abnormal growth. So not every abnormal growth is a cancerous growth. Yes, some of them are, but not all of them. And now let's talk about a few of the different types of terminology that you may hear out there that once again kind of explain morphology, because like I said, morphology is the characteristics of that growth. And that's how they determine if that growth is a malignancy, is it benign, is it uncertain. And so once again, make sure you understand that, because it can impact how you code and what you code. So for instance, if the patient have adenoma, well, you might think adenoma, if you don't know anything about coding, you might say, well, this is a cancer. No, it's not. But how would you know that? Your code book will help you to identify these different, when your physician give you a morphology, instead of using the term cancers or using the term malignant or using the term benign, they may give you the morphological type. And your ICD-10-CM code book index will help you to identify that morphological type. Now, of course, you can always go to Google or whatever search engine you like, put it in, but learn to use your code book. Now, I know you're going to say, well, Mary, we don't always have code books. You got one online, okay? When you learn how to use your code book, it's really going to make you a better coder. It really will. So when he gives me the diagnosis of adenoma, I don't know what an adenoma is. I will go to my index and I go to the main term, adenoma, and it gives me an instructional note there. And that instructional note said, see also neoplasm benign by sight. So it gave me that instructional note. And that instructional note is saying, if you don't know anything else, you don't have a pathology, then it is to be coded as benign. If that adenoma is identified as an adenocarcinoma, it gives you this instruction as well, then you're going to go to your neoplasm table, and you're going to go to site malignancy. See? And so I gave another example of you having a villous adenoma. An adenoma is spelled A-D-E-N-O-M-A. That's my main term. Villous is an adjective that's further defined, defining that. V-I-L-L-O-U-S. Now, because adenoma was benign, you may think that one is benign too, but it's not. When you go to that, when you go to adenoma, go to that subterm, it tells you to see uncertain behavior. So you can see why it's important that you understand where these codes gonna go. You understand this morphological type, because not everything gonna be coded as a malignancy. if you have a non-infiltrating carcinoma of the left breast. Oh, you say, oh, it's non-infiltrating, it's a carcinoma. It is malignancy. No, it is not. It is a malignancy, but it's a very small malignancy, and you code it differently. So when you go to that terminology in the index, it will tell you to see in situ, IN-SITU. It's coded differently. And you might say, well, Mary, why is this important? Because it could affect your reimbursement. It could be a compliance issue when we're coding things incorrectly. So if you're an inpatient coder, it's going to affect your MSDRG. It could affect your MSDRG payment. It could also, outpatient, physician office, and even inpatient, affect the HCC. Because, see, an adenoma is not an HCC, whereas an adenocarcinoma, depending on the site, may be a HCC. And therefore, if you coded everything out as a malignancy, and it is not, now you are out of compliance. You're coding inappropriately. You also have to remember, so we talked about the morphological type, how important it is the characteristics of the neoplasm, and they also refer to it as histology. So now, and have you ever noticed sometimes, especially with breast cancer, and I'm beginning to notice with colon cancer, they will actually give you more descriptive terminology as to the specific type of cancer that the patient may have. You know, is it HER2 positive? Is it HER2 negative? And some of these specific characteristics, you may have an additional code you can use. In ICD-10 CM coding, they just code, if you have breast cancer that's a HER2 positive, your breast coding cancer is just going to be the C50 or whatever the case may be. But then you can pick up a Z code, I think, for the HERS too. Now, if you work in a cancer registry, and that's a really, really good field to get into, if you wanted to get into that as well, they do more with the morphological type. They also use the ICD-10 code, but they have some M codes that they use as well to identify more of the characteristics of that cancer. And maybe that's where we get all these studies on cancers, we get all these new drugs on how to treat cancer. It could come from being able to identify the characteristics of that cancer. And so now remember, there's two types of cancers that we code in ICD-10. We code solid organs, which means that could be your liver, that could be a lung, that could be a breast, but it's a solid organ. We also code the hematopoietic/lymphoid cancer. And once again, the hematopoietics are the ones that's arriving in the blood, and then the lymphoid, of course, is arriving in the lymph nodes. And so we got those two types of tumors going on. And they each have their own set of ICD-10-CM codes. So you want to be aware of that. In addition, we have some additional types of cancer that is very specific that you may not find in that table, the cancer table, the neoplasm table. You got Merkel cell carcinoma. We have neuroendocrine cancers. We have carcinoid tumors, which is a form of cancer that can be malignant or benign. And then we have what they call ectopic tissue cancer. This is actually when the cancer breaks off, I assume, and it implants itself somewhere else. So there's some very specific codes for that. When you have an ectopic, we don't have specific codes for it, but we got a very specific guideline that we have to use when patients have ectopic cancers. going on. So I think we pretty much covered everything there. So just remember that these your lymphoids can spread. Myeloma is another form of myeloma is another form of blood cancer. So we have multiple myeloma. We have our leukemias going on. Your leukemia can be acute or chronic, or it can be subacute. It can be chronic that goes into acute. Now, once again, you are not a physician. I'm not a physician. The physician is going to make these diagnoses for you using very specific criteria that they have. Okay, so this part one, we talked about the foundation, the different types of cancers we have, the morphology of the cancer being how important that is. And so in the part two, we're going to actually get into some of the coding guidelines and coding rules there. So don't forget to follow me on LinkedIn and Facebook, TikTok, out there on TikTok, and Instagram. So we're getting Instagram going. I encourage you all to follow us there. Go to www.mascodingsolutions.com, our website. Check out our Medical Coding Lounge. Become a member of the Medical Coding Lounge today. And don't forget to like this video and subscribe to this video.